Hey guys, welcome back to the channel. Today we are diving into a topic that is absolutely crucial for protecting your well-being, or the health of your parents, grandmothers, and grandfathers. If you or your loved ones are over 70 and your doctor is thrilled to see those textbook numbers of 120/80, stop right there and listen very closely. A large-scale study published in the highly respected JAMA, Journal of the American Medical Association, completely challenges our traditional understanding of blood pressure standards. Researchers spent 5 years tracking 15,000 seniors, and the real-world evidence fundamentally contradicts standard medical dogma. The study revealed that seniors keeping their blood pressure at that so-called perfect level had a 28% higher risk of suffering serious, debilitating falls, and experienced significantly worse overall health stability and functional decline compared to those whose numbers were allowed to remain moderately higher. Over the next 17 minutes, I am going to break this down for you step by step. The exact blood pressure range associated with the highest quality of life and longest independent survival in older adults. Why standard targets might become distinctly unsafe once you pass the age of 75. And the single, simplest test you can perform in your own home tonight to protect yourself from a sudden, devastating fall. Before we go any further, please take a quick moment to drop a comment right now with just your age. Just the number, nothing else. I want to see the age distribution of our community today, because medical guidelines for ages 65, 75, and 85 have profound, fundamental differences. And if you have ever felt a brief moment of dizziness, room spinning, or lightheadedness when standing up from a chair or getting out of bed, add the word dizzy next to your age. You will understand exactly why this is so critical in about 3 minutes. Let's look at a scenario playing out in thousands of clinics across the country right now. A 78-year-old patient comes in for a routine checkup. The blood pressure cuff reads 145/86. The doctor opens up the standard clinical guidelines on the computer screen, sees the rigid target requiring systolic blood pressure strictly below 130, and immediately reaches for the prescription pad. One medication gets added, and then for good measure, a second one. 6 months later, the patient returns, and the numbers look beautiful on paper. 124/78. The doctor is pleased, gives the patient a metaphorical gold star on their chart, and everyone chalks this up as a medical success story. But what do those rigid, one-size-fits-all guidelines fail to account for? That same 78-year-old wakes up in the middle of the night to use the restroom. They swing their legs out of bed, stand up, and within seconds, their blood pressure violently plunges from 124 down to a critical 88/56. Due to gravity, blood instantly drains away from the head, leaving the brain severely deprived of blood flow. The room begins to tilt and spin. The patient reaches out frantically to steady themselves against the wall, misses, and suddenly, we are no longer talking about neat numbers on a medical chart. We are talking about a severe hip fracture, emergency surgery, weeks in a rehabilitation facility, and a cascade of medical complications that all too often results in a permanent loss of independence. That massive gap between what the latest science shows and how medicine is practiced daily is taking a massive toll on seniors' independence. Now, let me explain something that might sound completely counterintuitive at first. I need you to stay with me here because this is where everything changes for your health. For decades, the cultural mantra has been incredibly simple. The lower your blood pressure, the better your health outcomes. For middle-aged adults, people in their 40s and 50s, that is absolutely true. Getting your hypertension under strict control in midlife is a rock-solid, proven way to prevent heart attacks and strokes decades down the road. But something fundamental shifts after you turn 75. The data demonstrates that seniors whose top systolic number consistently sits between 130 and 145 actually experience better overall physical stability and longevity than those whose pressure drops below 120. They have fewer falls, fewer fractures, fewer emergency hospitalizations, and significantly better preserved memory and cognitive function over time. Meanwhile, the group striving for that textbook-perfect 120/80 experienced a dramatic spike in dizzy spells, syncope, the medical term for fainting, acute kidney distress, and an overall decline in general health metrics. Your circulatory system at age 75 is not just a 45-year-old system with a few more years on it. It has undergone structural transformations. Here are the 3 critical physiological reasons why your body actually requires higher pressure as you age. Arterial stiffness. Over time, the walls of our large arteries naturally lose their elasticity. Think of a brand new, highly flexible garden hose versus one that has been left out in the sun for 20 years. The old hose becomes stiff and rigid. A very similar process happens to human arteries. It's a condition known as arteriosclerosis. When the heart pumps blood into these rigid tubes, the vessels can no longer expand smoothly to absorb the pressure wave. Because of this, the body requires a slightly higher baseline pressure to guarantee that blood successfully fights gravity and reaches your brain and your kidneys when you are standing upright. Decline in baroreceptor function. Baroreceptors are microscopic pressure sensors embedded in your blood vessel walls. They act like an advanced onboard computer, instantly detecting shifts in pressure and signaling the brain to adjust. When a young person stands up quickly, these sensors notice the sudden downward pull of blood within milliseconds, triggering an immediate fix. The heart rate increases slightly and blood vessels constrict to stabilize pressure. But as we age, these sensors become sluggish and less sensitive. If your baseline pressure is already forced down too low by medications and your internal sensors are responding too slowly, you get that sudden, uncompensated drop in pressure when you stand up, known as orthostatic hypotension. Altered medication metabolism. At 75, our kidneys and liver clear substances from our bloodstream at a fraction of the speed they did at 45. A dose of blood pressure medication that is perfectly tailored for a 40-year-old can be completely overwhelming for their elderly parent. The medication lingers in the system much longer, accumulates, exerts an overly aggressive effect, and can relentlessly drive blood pressure too low. Let's look directly at the specifics of that JAMA internal medicine study, because the details matter immensely. The researchers followed a massive cohort of 15,342 adults over the age of 75 for an average of 5 years. It is critical to note that these weren't hand-picked, perfectly healthy, robust seniors. These were real-world older adults from everyday communities. Many lived with type 2 diabetes, had histories of stroke or heart disease, and displayed varying levels of physical frailty. The participants were categorized into groups based on their average systolic blood pressure. The findings were a wake-up call for the medical community. The best overall health outcomes and highest survival rates were found in the group with a systolic pressure between 130 and 140 millimeters of mercury. Not below 120, but right there in that moderate, middle-of-the-road range. Conversely, those whose pressure dipped below 120 faced harsh consequences. Their risk of sustaining a serious fall requiring hospitalization shot up by 28%. They had significantly higher rates of acute kidney injury because their kidneys simply lacked the necessary fluid pressure to filter waste products properly. To be clear, the group with a pressure consistently above 150 also ran into serious trouble, showing an expected increase in strokes and cardiovascular events. But the true revelation of the study was that excessively low pressure in an older adult poses just as severe a threat to health and independence as excessively high pressure. The sweet spot that protects physical function and preserves quality of life is noticeably higher than conventional clinical manuals suggest. What is truly surprising to me is that a simple, zero-cost, 3-minute test exists that can immediately tell you if your blood pressure medications are putting you at risk for a dangerous fall. This is called orthostatic vital sign measurement, and unfortunately, the vast majority of physicians do not perform it routinely during a standard visit. Let me teach you exactly how to conduct this test safely at home tonight. All you need is a standard automated digital blood pressure monitor with an arm cuff. The strict testing protocol. Lie down flat on your bed or couch and rest quietly for a full 5 minutes. Do not talk, do not check your phone, just completely relax. After 5 minutes, while still lying completely flat, turn on the monitor and take your blood pressure. Write down both numbers, the systolic and the diastolic. This is your baseline resting pressure. Now, carefully but steadily stand up on your feet and immediately, without waiting, start the monitor to take your blood pressure a second time while standing up. Do not wait a minute or two. Measure right away. Record these numbers next to your first set. Now, compare the two readings. If your top systolic blood pressure dropped by more than 20 points, or if your bottom diastolic pressure dropped by more than 10 points when you stood up, you have confirmed orthostatic hypotension. This is a major, undeniable red flag. It is a direct signal that your current medication dosages are too aggressive, or that the target blood pressure set for your body is too low for your unique anatomy. Even if your sitting measurements look pristine, this rapid drop upon standing means your brain is operating on insufficient pressure during your active hours. Let's look at a quick example. Suppose your lying pressure is a wonderful 125/78, but the moment you stand up, it plunges to 98/64. That is a 27-point systolic drop. It means that during the hours you are vertical, walking around, tidying up, cooking, your brain is experiencing a constant deficit in blood supply. You feel perfectly fine sitting or lying down, but the moment you stand, your system is pushed to its absolute limit. This is the exact check your doctor should be performing at every single appointment if you are over 70 and on medication. If they aren't doing it, track it yourself and bring your log to your next appointment. So, what are the safest, scientifically backed ranges for blood pressure as we cross these age milestones? Based on recent clinical evidence, researchers suggest the following general targets. Remember, these are guideposts to discuss with your provider, not rigid, unbending rules. Age group, 65 to 74. If you are generally healthy, physically active, and manage no major competing chronic illnesses, aiming for a systolic range of 130 to 140 millimeters of mercury is highly reasonable. This provides solid cardiovascular protection while ensuring adequate blood flow to your vital organs. Age group, 75 to 84. For older adults who are relatively stable, the evidence strongly supports a slightly higher systolic range of 135 to 145 millimeters of mercury. Notice that this target is intentionally adjusted upward compared to the younger bracket to accommodate arterial stiffness and slower sensor responses. Age 85 and older, or anyone dealing with high physical frailty. At this stage, a systolic range of 140 to 150 millimeters of mercury is frequently the safest approach. At this point in life, prioritizing the prevention of falls, preserving cognitive clarity, and maintaining daily independence takes absolute priority over aggressive, numbers-driven blood pressure lowering. What about the bottom number, diastolic? For older adults, it is vital that your diastolic pressure does not consistently drop below 65, and ideally stays between 70 and 85 millimeters of mercury. A very low diastolic pressure drastically reduces the blood and oxygen supply directly to your heart muscle during its relaxation phase, which can trigger arrhythmias or chest pain. If your bottom number is regularly below 60, that warrants an open conversation with your healthcare provider, even if your top number looks great. Let's consider a real-world example. We have a 73-year-old patient managing type 2 diabetes and a history of a single heart attack 5 years ago. Their current blood pressure sits at 148/86. Should we aggressively force them down to 120/80? Absolutely not. Should we leave them at 150? Also no, given their cardiovascular history and diabetes. For someone in this specific situation, current research points to an optimal systolic target around 130 to 135 millimeters of mercury. This provides a balanced baseline, low enough to offer protection for the heart and kidneys, but not so low that it induces orthostatic dizziness and fall risks. Furthermore, reaching this target must be a gradual, step-by-step process. Every time a medication is adjusted, a provider should check orthostatic vitals and screen carefully for subtle symptoms: unprovoked fatigue, mental fog, or momentary weakness. Any of these signs can mean the pressure is being driven down too low for that specific individual, regardless of how perfect the numbers look on a digital screen. Remember, blood pressure is a highly dynamic, living metric. It fluctuates naturally throughout the day based on your sleep quality, stress levels, hydration, or even the anxiety of being examined, the famous white coat effect. A single, isolated reading of 148/86 does not mean you are in a continuous crisis. That is why routine home monitoring is so incredibly valuable. It reveals your true, real-world average over time. Let's establish a concrete, actionable plan that you can put into motion starting tonight. Keep a written log. If you are over 70 and taking blood pressure drugs, ensure you use a reliable home monitor. Check your readings twice a day, once in the morning and once in the evening, for 2 weeks. Keep a neat written record. Test for orthostatic drops. Perform the 3-minute lying to standing test I outlined earlier. If you document a systolic drop greater than 20 points or a diastolic drop greater than 10, write those specific numbers down. Assess your symptoms honestly. Be completely truthful with yourself. Do you experience momentary unsteadiness when you stand up? Do you have periods of unexplained daytime fatigue or trouble focusing? Don't just blame aging. These can be direct signs of overmedication. Schedule a target discussion. Make an appointment with your doctor specifically to review your personal blood pressure goals. Bring your 2-week log and your orthostatic measurements. Ask directly, given my age, my history, and my daily function, what is the safest target for me personally? Is 120 truly appropriate? Speak up about side effects. Never suffer in silence or assume that feeling washed out or dizzy is just the price you have to pay for clear readings. In the vast majority of cases, medication doses can be gently tapered, drug classes can be switched, or target goals can be adjusted to restore your vitality while keeping your cardiovascular health fully secure. You now possess insights that a huge percentage of patients and even many healthcare providers haven't fully synthesized. You know that universal numbers do not work in a changing body. You understand where your personal sweet spot lies, and you know exactly how to test yourself for hidden drops in pressure. You are no longer just a passive recipient of medical instructions. You are an informed, empowered advocate for your own longevity and quality of life. And that is incredibly powerful. If this breakdown brought you clarity and gave you the tools to advocate for yourself, then our time together has been a success. Please drop a comment right now saying "informed" if you feel ready to have a collaborative, intelligent conversation at your next clinic visit. Share this video with your friends, neighbors, or family members over 65. Help them protect their independence. Don't forget to subscribe, because my core mission is to translate complex medical science into practical, real-world strategies that keep you healthy and safe. In our next video, we are going to look closely at a topic surrounded by massive confusion. We will name 3 natural supplements that rigorous science shows can gently support optimal vascular health. And we will call out 2 incredibly popular products that are an absolute waste of your hard-earned money. You definitely want to catch that, given how much misleading marketing exists in the supplement space. I'll bring you the unfiltered, evidence-based facts. I'll see you in the next video.